Recording.
Hello, everybody, and thank you so much for joining me this evening for this very interesting but somewhat complicated topic, combating autoimmune challenges naturally. Honestly, this topic, is something that I could probably divide into, 6 or more talks of an hour each. But we're going to try to really squeeze everything into one 45-minute session today. So please bear with me. I'm going to try to get across some of the most important points, and you are welcome to ask any questions as we go along here. Feel free to just type your questions into the chat box, and towards the end, I'll go ahead and make sure I address and answer all of your questions. So let me start off by introducing myself. I'm Sushma Hirani. I practice functional medicine. I did my residency and board certification in family medicine and practiced for some time in a traditional family practice office, but realized there was a lot of things I couldn't treat within the boundaries of traditional medicine. Anyway, that's when I started exploring more alternative forms, and here I am today. I've been practicing functional medicine for over 15 years now. I am the medical director at Rose Wellness Center, and I'm proud to say I really enjoy and love what I do. There's nothing more satisfying than seeing patients actually get better when they've been dealing with health issues chronically for so long. So without further ado, let's get started here. Let's get started with just some of the basics. What is the immune system? Well, the blood cells that comprise our immune system help protect us against harmful substances like bacteria, viruses, toxins, even cancer cells, okay? So basically everything that comes into our body that doesn't belong, that our body doesn't recognize, is a foreign invader. And these foreign invaders are known as antigens. Okay, so you can see in the little cartoon there on the left side, we see the antigen. Our immune system recognizes these foreign antibodies and marks them, okay, by producing antibodies. So you can see how there's that upside down Y cap, if you will, on the antigen. That's kind of how that particular foreign invader has been marked. Okay, so that's how the immune system, the rest of the immune system, then recognizes that particular invader and says, hey, that's the enemy, let's go attack and destroy. Okay, and hence the cartoon, right? Ned learned the dangers of accessorizing with antibodies. So having a balanced immune system is extremely important. Okay, a healthy immune system is so essential for normal growth and development and for maximized, long life. So what happens if you have an underactive immune system? Well, it may not be able to adequately defend us from these infections or foreign invaders, right? Which can lead to a weakened body and sometimes even life-threatening consequences. We depend on our immune system in identifying these foreign intruders and basically fighting them and getting rid of them. COVID, let's take that as the most recent example. COVID was a novel new virus. Our immune system didn't recognize it and hence, couldn't attack it or destroy it quite as well. All right, now the opposite can happen too. You can have an overactive immune system. So if the immune response is activated without a real threat, or if the immune system is not turned off once that danger passes, then this can result in autoimmune conditions or exaggerated allergic responses. So basically, autoimmune means the loss of the ability of our immune system to clearly differentiate between what's known as self and non-self, right? What is a foreigner and what is our normal tissue? Here's a great picture to describe that. You can see on the top there, the immune system goes, oh, look, the intruder, destroy. And that poor little cell, he's like, hey, wait a minute, I'm one of you. I'm a normal cell, I'm not an invader. And they're like, well, don't listen to her lies, right? So this basically describes, in a very simple form, autoimmune disease. Another slide over here, you can see on the left side, this is what happens in a healthy immune response. So harmful things enter the body, a virus, a bacteria, okay? Again, like we showed before, those antibodies mark those harmful things as foreign invaders, or they're quote unquote bad. The rest of the immune system says, oh, those marked things are bad, so let me go and attack it and destroy it, and basically gets rid of it, right? So our immune system protects us from disease and infection. An autoimmune response is different, right? So we see normal on the left side where the immune system is attacking those harmful things. But on the right side, we see the immune system has gotten confused. It starts to attack those normal, healthy cells also. So in this particular slide, this is autoimmune hepatitis. So our immune system has become confused and overreacts. So I don't like the term autoimmune disease. I think it's more accurate to say that my immune system is so proactive that it scrimmages with itself. How appropriate. All right. So this slide kind of just shows some of the different examples of some of our immune cells. You can see on the top left there, we see the natural killer cells. Then we see the cytotoxic cells, which also kills the bad guys. Then we have something called memory cells. It remembers what that bad guy is. So the next time that same invader comes in, like the flu virus or, some other, stomach bug, it's able to have a much faster, better response. And then we have a different type of a cell called the suppressor or Treg cells, T regulation. So this is what calms the immune system down after the destruction has been done, right? So the immune system has already destroyed the invader. The suppressor cell says, okay, that's okay, calm down now, everybody relax, we're done. So if we don't have enough suppressor cells or Treg cells, the immune system never really calms down. It keeps attacking and attacking and attacking. It just goes crazy, right? And that's also another way we develop autoimmune disease or an exaggerated allergic response. So let's look at some statistics. There's over 80 autoimmune diseases known by medicine. 50 million Americans have an autoimmune disease comprising a major US health crisis. Okay. And less than 13% of Americans can even name an autoimmune disease. They do tend to run in families, although that's not always the case. Autoimmune diseases are the top 10 killers of women under the age of 65. That's pretty significant. And it just so happens that about 75% of autoimmune diseases actually occur in women as well. Autoimmune diseases represent the fourth largest cause of disability among women in the United States. I mean, these statistics are pretty significant. Autoimmune disease is definitely a real problem. Like I said before, there are, just so many different types of autoimmune disease. Again, depending, the base concept is the same, right? That immune system gets confused, it loses recognition of self versus non-self, and it starts attacking your own tissue. Now, depending on what tissue it attacks, that's the type of autoimmune disease you're going to have. So for example, if your joints are being attacked, you may have rheumatoid arthritis. If your thyroid is being attacked, you may have Hashimoto's hypothyroidism. If your brain is being attacked, you may get multiple sclerosis. If your gastrointestinal tract is being attacked, you may get ulcerative colitis, and so on and so forth, right? There's just so many of them out there. Oops, sorry. All right. So what is the traditional medical treatment for autoimmune disease? Well, typically, we just talked about an overactive immune system. So typically an immune suppressing medication is used. So, you're given biologics or certain medications which suppress your immune system. They say, okay, stop being overactive. Okay. Other times anti-inflammatories are used. The problem with these is they can have so many different side effects. All right, they can lead to intestinal bleeding and kidney failure and depression, psychosis, bone loss, muscle loss, diabetes, infection, and even cancer. Okay. Now, don't get me wrong. These medications can be life-saving and can help people get their life back and even necessary for some people. But the point is it the only treatment? No. And in fact, should it be the first line treatment? I don't believe so. Of course, everybody's got different opinions. So functional medicine helps to provide another type of treatment looking for the root cause. Okay, so let's find out why you have that autoimmune condition. Let's not just suppress it with the Band-Aid and medications. The example I give for that is, suppose, you're standing on a thumbtack, it's giving you a lot of pain, and you keep taking pain medicines. Well, should you treat it by keep taking the pain medicines, or should you remove the thumbtack? Right? So again, the root cause functional medicine is remove the thumbtack. You just have to find out what that thumbtack is, which is triggering the autoimmune condition. Now, the pain medicine can be a temporary Band-Aid, but it's definitely not the solution. Okay. Once you remove that thumbtack and you rebalance things in the body, you can start to heal. Whereas if you keep taking immune suppressant medications, usually you have to take it for life because it's not really healing anything. It's just keeping your symptoms under control. Again, very necessary in some people, especially if you're very severe or have had this for a long time. But usually not something you want to jump to right away. You want to try to find the cause, fix it, and save these medications for when absolutely needed. Those, like I said, the side effects, you see all those TV commercials where they go on and on about the side effects of the medication. And how many of you are looking at that and saying, gosh, it may be easier to just stay sick, right? So again, you want to see what's worse, the illness itself or the side effect of the medication. Now, what are some of those root causes of autoimmune conditions? As the slide suggests, there can be so many different root causes, right? It's almost overwhelming to look at the slide. Now, functional medicine examines the way the body functions as a whole. The focus is on finding that imbalance in the immune system instead of simply suppressing it. And there is no one size fits all description. It's going to look different for everybody. So for example, if 10 people walk in with Hashimoto's hypothyroidism, in one person, their trigger could have been gluten, that, they're eating gluten and that's what their thumbtack is. And another person, it might be mercury or glyphosate, a type of chemical. And maybe that's what that person's trigger is. And then the third person, it could be stress. Maybe they had an extremely traumatic, stressful event, and that was the trigger that caused their autoimmune condition, right? So again, same condition, different thumbtacks, different reasons or root causes. Now, that being said, there are 5 categories of the most common root causes. In other words, these are the 5 things that probably need to be looked for in almost everybody with an autoimmune condition to really look for those thumbtacks or the root causes. Generally speaking, studies have shown that genetic predisposition accounts for about 30% or a third of all autoimmune diseases, and the other 70% is due to environmental factors. Okay, so what are those factors? As you can see on this pie chart, the 5 common ones are leaky gut, diet, toxins, infections, and stress. And we're definitely going to be talking about, all of these 5 categories in detail as the rest of this presentation. So in a landmark study done in 2009, Dr. Fasano suggested that 3 things must be present for an autoimmune condition to develop. And this really is true in most situations. Usually there's some sort of a genetic predisposition or a family history. There's a trigger. Okay, that trigger could be any of those 5 things we talked about: stress, infection, toxin, etc., and a leaky gut. In fact, a leaky gut is almost always involved in the development of an autoimmune condition. So if somebody's got a leaky gut, I'm usually pretty aggressive about treating that because I know that can lead to other future, possible health effects. Now, a leaky gut doesn't necessarily mean that you have an autoimmune condition related to the gut. And it also doesn't necessarily mean that you have symptoms of digestive troubles. Okay, you may have perfect bowel movements and no indigestion, but that doesn't mean that you don't have a leaky gut, because leaky gut can present itself in so many different ways. And a lot of those symptoms are typical of autoimmune conditions: achy, aches and pains, just basically feeling miserable. So what is leaky gut? Well, as you can see on the picture at the bottom there, you see the gut lining at the bottom. We should have a nice, healthy gut lining. And this is permeable. In other words, it has teeny tiny holes like a filter, okay? And it allows those small particles to filter through the lining to the other side, which is supposed to be the bloodstream. All right. The tiny particles is the good stuff, like minerals, vitamins, nutrients. All of those cross through the lining, go into the bloodstream, and then the blood carries those nutrients to the rest of our body, to our cells and our organs and tissues. Okay. Then you see those larger particles. That's the bad stuff. Okay. Toxins, fungi, yeast, undigested food particles, waste products, parasites, etc. So all those things can't fit through those little holes, right? So they don't leak through and they just continue passing out the lumen of our intestine until they exit and leave the body. And that's what it should be like, right? Those should be eliminated. However, when that lining gets damaged and those holes become bigger, well, then intestinal permeability develops. And that's the medical name for leaky gut, basically. Those large particles cross through that lining, go to the bloodstream. The blood carries all that gunk to the rest of the body, to our tissues and cells. And again, depending on where it's traveling and where it's going, it's going to cause it's going to cause damage to that particular tissue or organ, resulting in all kinds of conditions, including autoimmune disease. This is just another diagram showing the same thing. You can see on the left side there, you see a healthy intestinal lining, tight junctions are tightly, close together, those cells. On the right side, those tight junctions have broken down and the cells have become leaky. All those large bad particles, including gluten and the bugs, are all crossing through that lining into the bloodstream. And then what happens, it's important to understand that 70% of our immune system is actually right there in the gut. So our immune system gets triggered, right? Remember, it's supposed to protect us against all these foreign particles. So it goes, hey, what's going on? What are all these guys? They don't belong. Shoot, attack, destroy, right? So it creates this attack. And then if it's attacking constantly and chronically, it just starts going crazy after some time. It loses that precision in attacking the invaders, and it sets off waves of attacks to fight in this desperate bid to defend itself. Okay. And then eventually the body's own tissues become victim to all these attacks, creating a long-term inflammation and an autoimmune process. Another slide just showing the same thing. What are some of the common causes of damage to that gut lining? All kinds of things. The standard American diet, unfortunately, a lot of what we eat, in our processed foods is not really even food. There's a lot of chemicals in the stuff that we're eating out of packages and boxes and cans. And, our body doesn't recognize all that stuff. It doesn't belong. It's non-self, right? So we have to really be careful what we eat. You want to stick to a whole foods diet as much as possible for good health and longevity. And then chemicals, infections, glutens and grains, food allergies, and all kinds of things, can cause gut lining damage, as mentioned on the slide, including chronic stress. Some common medications can cause leaky gut too. Definitely antibiotics. Sometimes only one course of antibiotics can cause leaky gut, but frequently it's numerous courses. Antibiotics destroy a lot of the good bacteria, which are necessary to keep the gut lining healthy. You'll see a picture of that later on. A lot of common pain medications. So if you're taking Advil, Aleve, and these kinds of things all the time, it can definitely lead to leaky gut. Birth control pills, by the way, can lead to leaky gut. Acid reflux medications, even antidepressants. Just a little cute slide. I thought it was cute. Yeah, it's my leaky gut. Of course, it doesn't actually look like that. All right, so we want to talk about those 5 things. We talked about leaky gut. Next is toxins. All right, so this is a really, really big problem in our modern society today. Unfortunately, over 80,000 chemicals have been introduced into our society since 1900, and really only 550 have been tested for safety. Okay, 2.5 billion pounds of toxic chemicals at least are released yearly by large industrial facilities. 6 million pounds of mercury are poured into our air every day. In 2005, a survey was done which found an average of 148 chemicals in our body. And again, those were only the ones that they tested for. And what I think is one of the most stunning on this slide, the most stunning statement is that they actually examined the umbilical cord of babies in the womb. So even before you're born, right, when you're in the womb, they already found 287 industrial chemicals like pesticides, phthalates, flame retardants, Teflon, mercury, etc. So I mean, it almost seems like we're doomed even before we're born. So what happens? These chemicals basically come in and over time cause destruction, slow and gradual destruction to a lot of our cells, causing oxidative stress. When those cells change their structure, the immune system doesn't recognize it anymore, right? So those cells kind of act like foreign invaders, and the immune system starts to attack them. And that's how these chemicals can trigger an autoimmune response. A professor at Johns Hopkins School of Medicine said a quote, which I truly agree with. He said, "There is no doubt that autoimmune diseases are on the rise, and our increasing environmental exposure to toxins and chemicals is fueling the risk. The research is sound, the conclusions unassailable." And that's part of the reason why we've seen a dramatic increase in autoimmune diseases, throughout the years. I'm not going to go over the details on this slide, but you will be getting a copy of this presentation, by the way. So feel free to, really, go slower and digest all this information that I'm giving you and kind of go through the slides at your own pace later on. But here are just some, research articles on some of the most common toxins out in our environment. Heavy metals, an estimated 25% of Americans have some form of heavy metal poisoning. Again, same thing, these metals go and change the chemical structure of our DNA and tissues, look like a foreign substance, and our immune system attacks them. Again, numerous studies have been done proving that metals such as mercury, cadmium, and others, are involved in development of autoimmune diseases. I just thought this was an interesting study. This was a Canada-based group that did the study on 49 popular beauty products, and they tested them for heavy metals to see, well, what's the metal content like in all these popular cosmetics. And you can see the findings there. It's pretty stunning. Of the 49 beauty products that they tested, 100% of them had nickel in it. 96% had lead, 90% beryllium. I mean, these numbers are astonishing. And this might be one of the reasons why women, by the way, have more autoimmune conditions, just because women tend to use a lot more of the skincare products compared to men. So be careful with your skincare. Another very interesting slide here. This was a lab experiment done. It's basically frames of a video. And this video is showing the small intestine. So if you look at the slide at the left where it says start, those are all the little small intestinal cells. You see the little blue nucleus in the cell, and then you see the green sort of lining around that nucleus. That's the cell membrane, or the tight junctions in those cells. So you can see those are nice and healthy on the left side. And then what happened was glyphosate, a type of chemical, which is, by the way, common in gluten and grains and other things too. But this chemical was injected into the small intestine. You can see in about 6 minutes, those tight junctions started to disintegrate. 10 minutes, even further disintegration. And in 16 minutes, you hardly saw the tight junctions. They were gone. So in just 16 minutes, so much destruction of these small intestinal cells with glyphosate. I just thought this was funny. They wear these heavy duty masks when they're spraying all these chemicals on our crops, yet we pull them right out of the ground and eat them, right? So do you also eat those with that mask on? So some of the greatest exposures that we get come from these 4 areas: the foods we eat, the water we drink, the air we breathe, and the personal care products that we use. Okay, whether it be laundry detergent or, makeup or soaps and shampoos and things like that. All right. So, just cleaning up our more immediate environment as much as we can, that's doable or possible, can certainly be very, very helpful to keep this toxic load down. Okay. Watch what you eat. Drink purified filtered water. Hard to clean up the air. Part of that depends on where you live in the Himalayas versus in the middle of the city. But whatever, at home, for example, you can get an air purifier or keep your windows open, or some ways in which you can try to, just have cleaner air. And then, skincare products, just be careful what you're using. Now, in theory, the body should be able to process the waste products and toxins that we're exposed to, and mostly it can. But a lot of times, especially over time, the overwhelming number of chemical exposures can cause our body to have a hard time keeping up, right? So we can't always control the chemicals and toxicity that we're exposed to, but we certainly can influence and encourage our body's natural detoxification and elimination capability. So, this slide just kind of shows you some ways in which you can reduce exposure to the toxins in your environment. And really, there's a lot more things you can do. And then this slide just shows you some of the things you can do to support your body's ability to remove the toxins which have already accumulated over time, right? So you want to try to do some of these things on a regular basis to keep toxic burden low. It's all about the toxic burden, and everybody has different thresholds. Somebody might crumble with the 20% threshold, another person might crumble with an 80% threshold. So everyone's got different thresholds. It depends on your genetics and a variety of different factors, other factors as well. So, good idea from a preventive health standpoint to do all of this even before you develop any kind of chronic health illness. But definitely if you do have autoimmune or chronic disease, these are things you want to work on for sure. And you can actually measure, by the way, how you're detoxifying through certain tests. I want to capture this moment before toxic chemicals do. All right, so we talked about leaky gut, we talked about chemicals and toxins. The third broad category here is infections. So these different chronic infections like parasites, viruses, bacteria, mold, Epstein-Barr, Lyme, these are commonly found in connection with autoimmune. And even, this newest virus that we have, again, the COVID virus, has already been found to have a large connection in terms of developing autoimmune disease, okay? So what these infections do is they trigger the development of an autoimmune disease through a process known as molecular mimicry. And I'll show you a slide and what that means in just a moment. But also these, if you already have a pre-existing autoimmune condition, if you are then exposed to an infection, they can trigger a flare and increase symptoms. A lot of these infections, by the way, remain dormant or asleep in our body for many years, and they can resurface in times of stress. A classic example would be like the herpes virus, right? The cold sores, those come up when you're stressed out, or the chicken pox, right? Chicken pox is actually a virus. Once you get it, it stays in your body, really for the rest of your life. And then at some point in your adult life, with the stress as a trigger or some other situation, it represents itself as the zoster virus, which is basically shingles. All right, so what is molecular mimicry? This is basically a case of mistaken identity, where the immune system reacts to self-tissues and cells as if they were pathogens. All right, so let's take an example of rheumatic heart disease, which is a type of autoimmune heart condition. You see on number 1 there, this particular bacteria, strep, right, which is the common strep that you see with strep throat. It goes and infects a susceptible patient. The patient then makes those immune cells, T cells and antibodies, against the M protein of Streptococcus. Well, if a particular organ of that patient, like the heart, contains a certain protein, for example, myosin, whose structure resembles the same structure as that streptococcal bacterial protein, then the immune system can't really recognize who's who. So not only does it attack the streptococcal M protein, but it also starts to attack the heart M protein because they're lookalikes. All right. And then the bacterial infection is cleared because our immune system has cleared it, or you've taken antibiotics or whatever. But unfortunately, the rheumatic heart disease now develops because the heart has been attacked. Okay. So molecular mimicry is one way infection can cause autoimmune disease. The most perhaps popular or common example in the modern autoimmune disease world is the connection between gluten and Hashimoto's. The reality is gluten is a common culprit for a lot of different autoimmune conditions, but Hashimoto is very, very common. In fact, 90% of people with Hashimoto's probably have a gluten intolerance. Again, there's that molecular mimicry. You can see on the slide there, you see the gluten on the left side molecule. You see casein, which is milk, in the middle, and then you see the thyroid tissue. Notice how similar gluten and thyroid tissue look to each other. So when our immune system sees that gluten, and when it sees a gluten and attacks the gluten, it's going to attack the thyroid tissue as well because it doesn't recognize that's different. There's that molecular mimicry. So a person with Hashimoto's that does have gluten intolerance, if they keep eating the gluten, and that's a constant trigger, the immune system is constantly going to keep destroying the thyroid. Okay, so in that particular person, eliminating and staying away from gluten is going to be the thumbtack. That's going to be the treatment or the root cause of the Hashimoto's. Okay, usually it's not that simple, but that is a simple example that I've given you here. All right, so, the whole infection thing that we're talking about, it certainly could be something like Lyme, COVID, some sort of a major infection that comes into the body, but it doesn't always have to be a major infection. It could just be what's known as hidden occult infections in the body that can also trigger autoimmune conditions. And a lot of that occurs in what's known as our microbiome. Okay, so trillions of bacteria, yeast and fungi and other microbes live in us or on us. Okay, in fact, they outnumber our human cells by 10 to 1. That's pretty impressive. So for many decades, this microbiome or this population of pathogens was just considered mostly a nuisance and a source of infection. But, a lot more studies have been done on the microbiome in recent years, and they've discovered that wow, this particular group, almost calling it organ now, is indispensable to human life. All of these microbes work together, okay, like a supercomputer with untold intelligence and insight into restoring our health. Through this microbiome, or all these different microbes, information is actually extracted from food. The immune system is regulated. Inflammation is resolved. Different communication pathways are restored, and our natural defenses are repaired. So if that microbiome is off balance, all of these other dysfunctions occur and can go off balance as well. Okay, so the microbiome plays a large role in all kinds of health conditions, from heart disease to diabetes to mood issues. And, you may have heard of the gut-brain connection. Depression is linked to the gut, that kind of thing, and definitely to autoimmune diseases as well. So the microbiome communicates with and trains our immune and nervous system. They actually, they're developing right from the time that we're born. While we're developing, they're actually helping mature our immune system, particularly in the gut, but really all throughout the body. We have these microbes all over our body. Okay. And lots and lots and lots of studies in animals and humans have shown that changes in our microbiome have been linked to autoimmune conditions. There's no doubt about it. So, it's important to have the right kind of bacteria in the right balance in the right place, basically in the body, right? So what is dysbiosis? Dysbiosis is simply, the definition of that is simply an imbalance between the good beneficial bacteria and the bad pathogenic bacteria. The more good bacteria you have, the healthier you are. The more of the bad bacteria you have, the more disease you're going to be prone to. Great picture, right? A picture says 1,000 words. You can see all the good stuff that the good bacteria are doing there. They help maintain just a healthy digestive lining. They help eliminate, the bad guys. And then you see the bad guys on the other side, the unfriendly or bad bacteria. Those definitely are causing a lot of damage and dirt, if you will, and contribute, of course, to leaky gut and mess with our immune system, amongst all kinds of things. Okay, probiotics are so important for brain health and immune system as well. So can we actually impact our microbiome? Can we affect it? Absolutely, we can. Again, you want more of the good, less of the bad. There's lots of different things you can do: food and diet, other lifestyle changes, exercises, the medications and supplements that you take. All kinds of things can affect, our microbiome. And you can actually measure this. Again, you don't have to guess. You can test. You can do a stool test and identify, do I have enough good beneficial bacteria? Do I have too much of the bad bacteria? Do I have other microbes like candida, yeast, parasites, viruses that don't belong, etc.? Okay, so helpful to really understand what's going on in your microbiome. We can also test for leaky gut, amongst other things. So we talked about infections, toxins, leaky gut. Let's get into food and diet. Okay, food is powerful. If you really think about it, our body runs on food. Okay, that is our fuel. It's all these different micronutrients create all these different biochemical reactions in our body that get things going and, doing what they need to do. So food is one of the most powerful substances we put into our body, but it can be poison too. It can trigger inflammation and disease processes, if we put the wrong type of food in, right? So you've heard one man's poison can be another man's medicine. That very much is the case. Take gluten, for example. One person, gluten may not affect them at all. They're perfectly fine with it. They've talked about how whole grains are healthy, and they might even be healthy in one person. Whereas in the other person, the gluten is definitely a trigger and be poison. Okay. So when we eat those nourishing and healing foods, we can actually reverse the progression of disease, have fewer symptoms, and feel better. Remember, every bite we put into our mouth has the potential to heal our body. All right. And if we put the wrong things in, the most common inflammatory foods that are associated with autoimmune conditions are gluten, dairy, and sugar. I know all the good stuff, but unfortunately, that's the way it is. Right. So when we put those food in, we can be slowly destroying, causing damage. It's important to check for food sensitivities. This might be a benign food like an apple, for instance, right? You hear the quote, an apple a day keeps the doctor away. And generally apples have polyphenols and antioxidants and all these great things that we need. And generally we should be eating, those regularly. But if you are intolerant to apples, right? If you have a food intolerance, guess what? It's going to actually be causing you more harm than good. So, if there's a suspicion of food sensitivities, it's a good idea to test. Again, you can test for this and identify if that's a problem or not. Okay. Why? Because those food sensitivities do trigger that immune system, right? So if you're putting the wrong food in, again, that immune system goes crazy and tries to fight it. Now, it's not only digestive symptoms that may occur. So if you don't have digestive symptoms, you can't just assume you don't have a food sensitivity. Okay, common digestive symptoms include bloating, cramping, diarrhea, but really a lot of common symptoms of food sensitivities are outside of the digestive system, as you can see on the slide here: fatigue, insomnia, hormone imbalances, mood disorders, headaches, brain fog, joint pains. And actually, all of these symptoms are very common in people with autoimmune diseases as well. Food sensitivities are not always easy to understand or pick up because symptoms don't always show up right away. I mean, if I, eat sugar right now and within half an hour I'm feeling terrible, okay, I know for sure that's a problem for me. But sometimes it can take several days to even a week later to actually respond or react to that sugar negatively. So that's why sometimes it can be tricky to understand. So how do you know then if you have food sensitivities? You can do testing, blood testing. Now, this is different from food allergies, which you can pick up with the skin test at the allergist office. If that shows that you don't have any food allergies, that doesn't necessarily mean you don't have food intolerances, okay? So just remember those are two different things. In my gut presentation, I get into a little bit more about the differences and what all that means. So one way is through testing. The other way we can figure it out is through something called an elimination diet, in which we're removing the most common food sensitivities from our diet for about 3 to 4 weeks. And then we slowly add those back in and we monitor, we see how we feel and how we're doing. Okay. I put a whole slide just for gluten again, because this is a very, very common culprit, okay, as in terms of triggering not only autoimmune conditions, but other conditions as well. So some facts: more than 55 diseases are linked to gluten. 99% of people who have celiac disease or gluten intolerance are never really diagnosed. They don't really know it. And about 15% of the general population has been found to be gluten intolerant. Much more, by the way, in people that actually have chronic illness, okay? Maybe 1 in 3 or 4 people that actually have chronic illness have gluten intolerance. Common symptoms, again, could be digestive symptoms, absolutely, but are not limited to the digestive tract. You can have all kinds of other systemic symptoms as well, as you can see, including autoimmune diseases. Even PMS and infertility could be due to gluten intolerance. So animals want gluten-free nowadays too. All right, so again, you can look through these slides for all the details. I've tried to give you lots of just good information on here, but big pointers there: stop eating those processed and inflammatory foods and eat anti-inflammatory foods instead. Eat organic, get good quality water. Intermittent fasting can be very helpful. Glutathione, a very, very important antioxidant that can be helpful in so many ways to our body. And then eating those gut healing foods. Okay, nourish that microbiome with probiotic-rich fermented foods and prebiotic foods, which is the food for those probiotics. What are you not having? So I know sometimes it's going to be challenging, especially those people that are on these elimination or restricted diets. And, you want to try to focus on the positive. Don't look at the list of foods that you're not allowed to eat. Pull out the list of all the foods that you are allowed to eat. And there really are a lot, so pull out that list, take a look at all of those, and just focus on the foods you can get in and, stay on the positive side of that. We go into this 5R program for gut health. Again, a lot more in the gut presentation, but I've put some of the pointers, the big stuff on this slide over here. The 5R is basically remove the irritants. So you want to heal a leaky gut, definitely remove those irritants, right? The toxins, the infections, the irritating foods, all the stuff we just talked about. Restore healthy digestive function if that's a problem. re-inoculate, put back in those good bacteria, repair that digestive lining, heal the leaky gut, and rebalance your life. Again, even if you don't have digestive symptoms, you want to treat the gut. Almost everybody with an autoimmune condition should go through the 5-hour program for gut healing. Okay. Very, very, very important. Remember, again, 70% of our immune system lies in the gut. Vitamin D, I just kind of put a whole slide just for vitamin D, just to kind of put a reminder out there that vitamin D is an extremely important vitamin for modulating the immune system. It doesn't suppress it. It doesn't activate it. It modulates or balances it. And that's the beauty of vitamin D. You want to make sure you have blood levels somewhere between 50 and 70. Anyone with an autoimmune condition should definitely have vitamin D levels above 50. And again, you can test for this. Also put a slide on something called low-dose naltrexone. I don't know how many of you are familiar with this. Something in functional medicine that's popularly used in autoimmune conditions. If there is a prescription medication that I love, this would be one of those. Not something you get at a regular pharmacy. You would have to get it from a compounding pharmacy, and it is, of course, prescribed under appropriate situations by a physician. One of the reasons I like low-dose naltrexone so much is, one, it's very safe. It really doesn't have any kind of adverse effects. It can have some side effects, which are usually self-limiting and short-term and go away, but no adverse or long-term effects, and usually well tolerated if dosed properly. The key is how you dose it, okay? But what low-dose naltrexone does is it raises endorphins in your body. Endorphins are certain substances that help us to feel good. I know most of you know endorphins as feel-good chemicals, and really that is what they are. But endorphins also play a huge role in regulating the immune response and in reducing pain and inflammation. And guess what? Most people with autoimmunity have low endorphin levels, causing or contributing to that immune function dysregulation. Okay, so by taking in the low-dose naltrexone or LDN, you can raise those endorphins, improve or modulate the immune response, reduce pain and inflammation. And many studies have shown a wide range of health benefits with the low-dose naltrexone, especially with autoimmune conditions. So something to consider or think about. Not for everybody, but when appropriate, can work very well. All right, so we talked about toxins and infections and food and diet and leaky gut. And now our 5th most common category in terms of causes of autoimmune disease, and that's stress. And of course, this is an epidemic really in our modern life, unfortunately. Now, our body does have a pretty good capability to withstand all kinds of stress, physical, mental, emotional, even chemical stress. But traumatic or chronic stress has been linked to the onset and progression of autoimmune disease, and definitely many, many other conditions as well. Stress is like the gasoline in the fire of autoimmunity. In other words, even if you already have an autoimmune condition, if you can't control or manage the stress, it's the gasoline, okay? You're going to keep triggering that autoimmune response. Very difficult to get autoimmune disease under control if you don't manage the stress. Almost 80% of people report some sort of a large emotional stress before the onset of their autoimmune disease. In fact, any patient that comes into me with autoimmune disease, I always ask them, all right, so what was going on in the year or two before symptoms started? And usually there is some sort of an emotional stressful event. Not always, but a lot of times there is. So what does stress do? It releases the hormone cortisol, and cortisol plays a very big role in, again, modulating our immune system. Okay, what is prednisone? The steroid used as a medicine, that is basically synthetic or man-made cortisol. Okay, prednisone is used to help control inflammation. Well, the cortisol in our body also helps control or regulate inflammation. So high levels, low levels, going to impact our body in a negative way. And of course, if we've got, too much stress, it increases the likelihood of reactivating those dormant or sleepy viruses. It does promote damage to the gut lining, and it disrupts the bacterial balance, alters our microbiome. Chronic stress leads to a medical condition called HPA axis dysfunction. The layman's term or common term for that you may be more familiar with is adrenal fatigue. And adrenal fatigue is frequently associated with autoimmune conditions. Chronic stress triggers inflammation in the body, which of course puts a strain on your immune system and reduces your body's ability to heal. And also chronic stress increases overall oxidative stress or cellular damage, basically. Can we test how stress is affecting our body? Absolutely, we can. We can do a saliva test. We can do a Dutch urine test to measure the impact of stress in our body. And again, I go over that in a lot more detail on the presentation when we talk about adrenal fatigue. Now, by the way, when we treat that stress or those hormones, cortisol and DHEA specifically, which are associated with stress, so those go off balance with stress. But when we treat them, believe it or not, the immune system will also start to return to balance. So again, anybody with autoimmune, if it's indicated, it's worthwhile measuring these hormones. Okay, so very basically the gist of this slide or the summary of the slide is to find ways to get a better sense of control over our stress. Okay, stress reduction techniques really do matter. All kinds of research have shown that it helps, whether it be deep breathing, gratitude, mindfulness, meditation, Tai Chi, journaling, relaxation, hobbies, finding time for yourself, those feel-good chemicals, endorphins, etc. Whatever it is, it's not easy, but it's very important to manage stress in our life, okay? And all of these practices can help reduce the severity of existing disease and also reduce your risk of developing an autoimmune condition. And it's a lot of times it's the perception of stress, how you decide to react or respond to that stress. For example, if two people are sitting in an airplane and they see the scene below, same scene, one person may be stressed out the whole time, holding on to their, seat really tightly, going, oh my gosh, that's so scary. What if the plane crashes? What if we fall in there? I'm just going to be lost. I'm going to die. That looks so scary, and the whole time they're stressed and making all this cortisol, right? Whereas another person on the same airplane could be looking at the same scene and saying, oh my gosh, that's so beautiful. That's so peaceful. I just feel joy. I feel peace right now. I could just sit here forever, right? So again, same situation, two very different responses. So you actually can change the way you decide to react to stress. Again, not easy, but necessary to do. And you want to find a way, whether it be yourself or whether, you find other support to help you overcome that stress. Very important to manage it. So again, same stressor, just change the way you respond to it. How much longer do I have before I have to change to a healthy lifestyle? Believe it or not, I do get asked that question by patients. So my answer always is, you got to do it as soon as possible. Why wait? Don't wait. Okay. So in summary, again, I know this was a long topic and I probably lost some of you, but again, you will be getting this presentation so that you can quote unquote digest it, at your own convenience and your own time. Tried to give you a lot of just good, important information there. But here's a summary of, everything that we talked about. We didn't really get into exercise and sleep very much, but as you can imagine and probably already realize, those are of course very important as well. Exercise, amongst all the other good things it does, it is a natural anti-inflammatory. And then sleep, a lot of immune stuff, healthy immune stuff and healing and repair and metabolism and all these good things are happening at night when we get into a deep sleep, when our body actually has time to shift its focus away from our day-to-day stressors and concentrate on other things, when we're sleeping. So if we're not sleeping very well, if we're sleep deprived, of course, some of that can be compromised. So sleep is also very important to figure out why you're not sleeping. Again, there could be a biochemical cause to that. And if there is, like low melatonin, low serotonin, or high cortisol, then you want to make sure that you balance that. And then, of course, lifestyle changes to help with better sleep as well. So again, in summary, very important to just kind of look for those different thumbtacks. It could be as simple as one thumbtack. Sometimes and many times it's more complex. You may have 8 thumbtacks, 15 thumbtacks, and you want to just basically go through and remove them, right? But every thumbtack you remove reduces that threshold and burden even further. So the important thing is not just to kind of treat it and fix it, because a lot of times that's what will happen. People will feel so much better and feel great, and then they go and, they're still feeling good, but then they go right back to where they were before, right? So the most important thing is make it all a habit. Find changes that are doable for you, okay? Autoimmune disease is generally not curable, okay? But you can send it into remission, and it can be very manageable with natural interventions. The trick is not to be perfect, but practice doable and regular healthy habits. Consistency is key. So even if you are eating that sugar or whatever, try to keep it just at 20%, right? And consistently keep it that way. You want to build your health resilience. So once that balance has been restored, the next goal is to maintain that balance, regardless of future stressors. So if you have figured out how to deal with stress in the right way, when that future stress comes back, you would have dealt with it in a much healthier way, right? And it may not be a trigger again. So resilience is that ability to go out into the world and bounce back again when faced with the very same things that made you sick perhaps in the past. When we are resilient, we get sick less often and we recover more quickly. We become less susceptible to infection, allergens, and sensitivities. All right. So a reasonable goal with an autoimmune condition would be, let me reduce the frequency, the intensity, and the severity of the flares and keep those as low as possible. If your goal is to never have a flare, you probably will disappoint yourself. Okay. But if you can reduce that frequency and intensity significantly and live a normal, healthy, happy life, well, then awesome, you're successful. Okay. The ultimate goal is to stay well rather than simply feel better when the body feels unwell. Okay. So again, pull out those thumbtacks. You do have control. You don't have to resort just to a medication that might make you feel worse than you originally felt. Sometimes you may need it. And, a lot of times you may not. You can take control. There are lots of things that you can do, ways to go from unhealthy to healthy again. Okay, so take charge of your health. So thank you so much. You've been a wonderful audience. In a moment here, I will go ahead and answer any questions that you may have. Please feel free to type them into the chat box, and we'll go through some of those. If you think of any questions afterwards, or are not able to stay for this question and answer session, then please feel free to call the office and we can help you out as well. I am not currently accepting new patients, but I have other wonderful practitioners in Rose Wellness as well who are absolutely wonderful. And really, they use the same principles as I do. Everything that we talked about in this presentation today is really what we all use as a process to peel through those different layers, remove those thumbtacks, and get to the root of autoimmune diseases. So please feel free to call the office and schedule an appointment, or simply just ask any questions or get more information. Our phone number as well as contact information is all on this slide. Thank you so much for being a wonderful audience. I wish you truly all the best. Good luck.